All right. So in the last discussion, I think we talked about what backbone pain is, and we also talked about the spine problems. And from Dr. Marian's discussion and explanation, it's quite common here in Zambia, and the major reasons that she gave that has contributed to many Zambians having spine problems is one, the kind of lifestyle that we actually live. Secondly, the kind of work that we do. It's discovered that, here in Africa, Zambia to be specific, there's a lot of hard work that we do involving agriculture, mining, and lifting of heavy stuff. So all those definitely tend to affect our spine. And going forward, she also highlighted how, the spine problem can actually affect your sitting position, your lifestyle, your ability to walk, to sleep, and of course, to sit. We talked quite a lot about that. And to some extent, it can actually be dangerous because if it's not attended to, it can lead to paralysis, or you can even be failing to actually walk. And diagnosis, she talked about the importance of the moment you notice the symptoms, you need to get to your doctor so that your doctor can make a professional analysis and be able to ascertain whether you have a spine problem or not. Then when she was explaining about pain, she talked about the two types of pain. And she also talked about how the upper spine can actually affect the lower back pain, or the lower back as well. Now today we want to continue from the diagnosis to treatment and how you can actually prevent having this spine problem. So on your health talk today, we continue from the topic that we had last week, and Dr. Marian is with us even today. Thank you so much, Doc, for allowing us to visit you today.
No, you're welcome anytime. I'm happy that you remember everything.
Oh,
this is very good. Yes.
So last time we ended on a diagnosis.
Yes.
So once the diagnosis is made,
okay,
what is the next step that as a doctor you usually take?
Okay, so as I told you the last time, there is mechanical pain, which is problem in the muscles, and there is a pathological pain where there is certain pathology in the bone or in the nerve itself. When it's a mechanical pain, and this is the most common, and we can say this is benign, mostly with resting, with just modification of our sitting position, modification of our lifestyle, you will find that all this pain will gradually disappear. This is the mechanical pain. If you are having this type of pain, you are having low back pain or even neck pain, and you rest maybe for 2 days, you will find that gradually this pain will disappear. This is the most common type. Maybe 90% of back pain will just be mechanical pain, just need rest, modification of your workstation, maybe a good chair you are using, maybe good sitting position, sitting in a healthy position. All this will make the back or neck pain disappear. The other 90% of the other 10%, which is pathological, means that there may be a pathology in your spine. According to the cause, there will be treatment. Okay, so mostly when we are suspecting that there is something compressing on the nerve and we ask for MRI scan, the MRI scan will guide us in the treatment. If we actually find that there is something compressing severely on the nerve, so at that time I think your neurosurgeon will discuss with you about surgery. Because as I told you the last time, long compression on our nervous system, it's not good. Our nervous system, the brain and the spinal cord and the nervous, it's not regenerating. So once we discover that there is something severely compressing on our spine, the surgeon will discuss with you about surgery, and you must not hesitate because you need to recover, you need to move, you need to walk. Okay, this is when there is severe compression. When there is mild to moderate compression, maybe your surgeon will discuss with you also modification of your workstation, modification of your lifestyle, and he may add some physiotherapy. He may also talk with you about some injection, like epidural injection to relieve the pain. And he, of course, will tell you about follow-up with him.
How do you deal with back pain problems or spine problems as a result of injury. It could be that somebody was involved in a car crash, or maybe they had fallen at some point and maybe they injured their spine. How do you deal with that kind of injury?
It's multifactorial. First of all, the guide for us is his scan.
Okay.
Either we ask for a CT scan or MRI scan, and there is certain degrees for the fracture. According to the scan, we may tell the patient you need to wear a belt, dorso-lumbar belt, or even for the neck he can wear a collar. Maybe he can use this with some rest and some medication, and at that time this will be enough for him. Other patient, when we find that there is instability in his spine and there is no option, so at that time we will discuss with the patient fixation surgery. Means that we need to put screws and rods in the spine and to fix the spine to prevent more damage to the nerves. So there's two options, either belt and rest or either surgery, according to his scan.
Okay.
Yes.
There are times when somebody has a spine problem that is causing maybe neck pain.
Yes.
And there is always that some sort of a bandage wrapped up around the neck.
Yes.
What's the purpose of that?
Okay. You mean collar. By bandage, you mean collar. Okay. Some patient, when we do a scan to them, we find that, and this is common with old age and with hard workers, there is some bony osteophytes coming from the vertebrae, some bony prominences, small bony prominences. And this is mainly caused by friction of the bone, you know, as our spine is blocks over each other. Once we are hard workers, we are not using our spine in a correct way, at that time there will be some friction. This friction will cause some bony prominences. Sometimes this bony prominences cause some compression on the nerve, and there is a mild disc bulge that may compress our nerve. So at that time your doctor will recommend that you will use this collar. Why? To prevent more friction, to prevent more disc prolapse. So this collar is a way of protection. We use it to prevent deterioration if it's mild to moderate. And usually if we did any surgery in the neck, usually also we recommend using this collar for a while to fix the neck in certain position till the site of the surgery totally recover. Yes.
What are some of treatment problems or programs that you usually put patients on who have got a problem with the back and the spine?
Yes. As I told you, most of the patient who I see in my clinic is with mechanical back pain. So my first recommendation to this patient, first of all, you must change your lifestyle. Why I'm saying that it's a must? Because if you didn't follow the instruction now with this acute pain you are having, lately you will suffer from chronic pain. This pain will be with you for years and it will not be responding well to the medication. So everything in the beginning, when you receive proper medication, when you follow the instruction, everything will be fine. If you just forget about it and you are living the same lifestyle, at that time this will be turned into chronic back pain or chronic neck pain according to. So my first recommendation, first thing is changing your lifestyle, changing your workstation, as I'm telling you, sitting in a correct position. This is the first thing. And I recommend also every 1 hour, if you are sitting for a long time in your work, every 1 hour you need to move. As they are saying, moving is a lotion. It's like you are using a lotion to your spine and to your muscle. So moving is very important. This is the first thing, the lifestyle. The second thing I recommend is exercising. You must exercising. Movement is very important. Walking, even walking and running. I'm not telling you to go to a gym and play. No, not this. I'm telling you just about some walking, some running, maybe 10 minutes per day. This will be perfect for your spine. The third thing I recommend is physiotherapy, just to relieve the muscle inflammation and the muscle spasm. This is the main lines, the main 3 lines of treatment. First of all, your lifestyle. Second thing, exercising. Third thing, is physiotherapy. And the last thing, I sometimes give some medication to the patient to help to fasten this. Yes.
All right, so this medication that is usually given, is it targeted at pain alleviation or healing that part which has got a problem?
Mostly this medication, it's anti-inflammatory because the main problem is inflammation of the muscle. So the main medication is anti-inflammatory to decrease the inflammation of the muscle. This is the main medication. I usually use tablet and gel both together.
Okay.
Yes.
So when do you usually think surgery is appropriate?
Yes. As I'm telling you, the most common will be resolved with conservative treatment. The 10% which needs either medication or surgery, according to the examination and their scan, this will guide us. If there is something compressing on their nerve, and this may be presented to us with severe sciatica, severe brachialgia. You know, the sciatic nerve is the nerve responsible for movement and sensation of our leg. The brachial plexus is the part of the nerves that's responsible for movement and sensation of our arms. So if there is something severely compressing on these nerves, at that time there is no option. We have to go for surgery because, as I'm telling you, our nervous system is not regenerating. So please, I recommend to all the people who are listening to us, if you are suffering from any numbness in your hand, this means that there is something compressing on your nerve. If you find that there is some difficulty with movement, either moving your hand or moving your legs, you find difficulty with walking, please don't hesitate. You need to visit your doctor. If you find any abnormality with controlling your bowel, if there is severe constipation, if there is inability to control your bladder, don't hesitate. This means that there is something compressing on your nerves. This is red flags you have to put in your mind. If there is severe compression, at that time your surgeon will discuss with you what type of surgery you will need. Yes.
So, doctor, are you suggesting that surgery is usually the last treatment option?
Yes, of course.
Okay.
Yeah.
Okay. So obviously when somebody reports to you that I've been feeling this and you make your diagnosis and you discover that it's a spine problem, you try by all means to help them change their lifestyles, this and this and this and that?
According to his complaint and according to his examination. As I'm
Okay.
telling you, most of the back pain problem will be just mechanical.
Okay.
But there is 10% of patient, this I discover with examination. That's why I'm telling you, if it's a severe back pain, you need to consult your doctor.
Okay.
Because examination, it's the part which will make you either take this 10% or 90%. With examination, we will know this.
Okay.
And after examination, if I ask it for some scans, the scans will guide us in our way. Either we will go for surgery or either I'll give you medical treatment.
Okay.
So, you know, it's a step by step.
Okay.
You see your doctor, he examine you. According to examination, he may ask for some scans or he will just tell you, you will go for physio, exercise, lifestyle, whatever. Yes.
So according to your experience working here in Zambia, most of the patients that you see, at what stage do they usually bring the cases to you?
Most of the patients, they come late. Yes. Some of the patients, they come with already weakness in their legs. Some of the patients, they come with severe pain. Some of the patients, they were in a wheelchair because of the severe pain. You can imagine this, on a wheelchair because of the severe pain. So that's why I'm happy to talk with you about the back pain, to tell the people more about this problem. It's not difficult to manage it in the early stage. So if you come to your doctor in the early stage, the outcome of everything will be better. If you come in the acute pain, the outcome will be better. If you come with just the starting of the sciatic pain or the leg pain, the outcome will be better. But if you are coming too late, at that time, if you are having weakness, even if we did surgery, the outcome for the surgery will not be perfect. Because as I'm telling you again and again, our nervous system is not regenerating. Once it's not working, so for life it will be not working, unfortunately. Yes.
Wow. So you're simply saying it's not treatable.
What is not treatable?
The nervous system, if at all it's damaged, then
Yes.
it's
If it's
gone for
damaged,
good.
yes.
Wow. Okay.
That's why your rule in this field is very important. You have to make the people aware about this, because early presentation to the doctor, this is vital, especially for specialties like neurosurgery, because our nervous system, again, it's not regenerating. Not like the skin, once you have a scratch the second day it will be normal again. No, once you have weakness, it's very difficult to be normal again. Once you are paraplegic, it's very difficult to be normal again, because some patients come to me and they are already paraplegic for a years. You can imagine this, for a years. So the outcome will not be good. For us, sometimes in some cases, we recommend urgent surgery. No, you are having weakness now, so you will need urgent surgery now. We cannot delay it for the second day. You know, it's difficult, I know, but people must know about this. Once you are having any heaviness, any difficulty with moving your hands, any severe pain in your legs, any difficulty with walking, any heaviness in your legs, don't hesitate, please. You have to consult your doctor to have early management of your problem, either medical or surgical, according to your doctor's opinion. Yes.
All right, so to those who are just joining us, we are discussing spine problems and back pain. These are common, obviously, these are common in Zambian communities today. But one point that Dr. Marian has talked about today is, once you're having problems with your nervous system and it's not attended to, it does not regenerate. So once it's damaged, it's actually damaged for good. And here in Zambian communities, it's sad that in most cases we tend to visit our doctors when the situation is worse. For some, they're not even walking. For some, they're even being, driven on the wheelchair, and so on and so forth. So the message is loud and clear. Let us make our doctors our friends. Each time that you just feel something is wrong with your body, please let us rush to our doctors and have ourselves checked, so that as the problem is in its infancy, in its early stages, it's actually attended to. This is a very, very important topic we are discussing today. So make sure that you get as much information as you can. Now, Doc, when somebody comes with this problem in its later stages, what kind of help do you usually recommend at that particular stage?
Again, according to his scan and according to his examination. Sometimes I recommend doing surgery for him, just to do everything for the patient, to give him full chance. Even if he recovered 5%, 10%, it's better than zero, isn't it? Yes. So according to examination, according to the scan, we will do our best to the patient to have the best results, even if it's very little, but we have to do our best.
Okay. So what are the chances that if somebody comes with a case very late, they will recover?
Like a patient with paraplegia, it's very rare to recover.
Okay.
Yes.
Okay.
Yeah.
Wow. That one is a flashlight to our viewers, I guess.
Yes, that's why I'm telling you, your rule in this field is very important. You have to make the people aware about this. They must know that once they have a medical problem, a serious medical problem, like a problem with walking, no, you have to pay attention. You cannot overcome this by just going on the life. No, this is not right. You have to consult the doctor. What you will lose with consulting the doctor. And I prefer you consult a specialist.
Okay.
Yes, because sometimes the people just take painkiller. Okay, the pain will gone, but even the function with your nervous system will gone also. Yes.
So now, as somebody is on treatment, obviously there is also an aspect of management that comes in. Under management, what are some of the information and things that you usually share with the patient and also the family?
Like what? I don't get.
For example, if at all somebody has been put on treatment and they are left to go home.
Yes.
Exactly, to go and continue their recovery.
Yeah.
Is there any information that you share with the family of the patient and the patient in terms of the do's and don'ts so that the recovery process can go well properly?
Of course, I usually talk with the patient a lot, and I usually explain his scan to him. If I did MRI scan and I see something slightly compressing on his nerve or whatever in his scan, I have to show it to the patient in his scan to know what's his problem. Because once he is aware what's wrong with myself, at that time I'll obey what my doctor is telling me. At that time, okay, I must follow the instruction to avoid more damage to my spine or to my nerves. So usually I explain everything, and every doctor must do this because the patient must understand everything to be cooperative with the doctor, to follow his instruction. Either I'm telling the patient about exercise, about changing lifestyle. If he don't understand what's wrong with him, he will not obey this. He will not give any importance to this unless he is understanding. So understanding, this is your rule also. You must make the people aware about what common medical problems they may suffer from. Yes.
You're handling this case, doc, and you discover that this patient has brought the problem to you very late, such that very little can be done, and it's already late. Do you disclose that information to the patient to tell them to say, well, this is too late?
Usually I discuss with the patient, I explain to them, and I have to explain that also it's a late presentation.
Okay.
Yes.
Okay.
It's important.
Okay.
Yeah, to avoid it in the future with another patient.
Okay.
Yes.
Surgery. Before you undertake surgery with a patient, is there any counseling that is done to prepare the patient before they go into surgery? Counseling. Exactly.
Yeah. Of course. Counseling like explaining the surgery to the patient. Of course. I have to explain the details of the surgery to the patient with the benefit and the complication of the surgery.
Okay.
Because everything is our life has a success rate and a failure rate. Okay. Even if you are crossing the route, there is 99% that you will cross safely, and there is 1% that there is something will happen. And this is in surgeries also. There is success rate and there is failure rate. And all the patient must discuss with their doctors what is the success rate for my surgery and what complication may happen to my surgery. They must understand everything. Yes.
When you're having this discussion, do you usually have this discussion one-on-one with the patient, or maybe you also call for maybe family to come in?
It's according to the patient himself. If he wants his wife or his daughter or his son to be attending for this, so they are welcome. It's according to the patient.
Okay.
Yes, it's his case.
Okay.
Yes.
All right, so it's very important that you familiarize yourself with the operations of your health sector and your doctors as well. So it's quite an interesting aspect. Prevention is better than cure. That's the most important statement. So once you discover that you're not feeling too well, it could be that your pain each time that you're walking, maybe the back pain is giving you problems, or maybe the neck is giving you problems, you need to visit doctors. And like Dr. Mariana has pointed out, not just like any other doctor, but it's important that you have an audience with specialist doctors, because they will be able to take you through and be able to make that cross-examination, which will help in terms of pinpointing what the actual problem is. When we get back from the break, we want to take a look at now the prevention part of spine problems and backaches as well. All right, so we're here at Forest Park Specialized Hospital here in Lusaka, and our main visit here is we had an appointment with Dr. Marianne, who is a neurosurgeon here at Forest Park Specialized or Specialist Hospital, and our key area of interest is spine problems and backaches as well, something that many Zambians actually tend to experience. The number one cause of spine problems and backache problems is your lifestyle. Lack of, exercises, living a sedentary life, the nature of your job. If you're too much into labor-related jobs, or perhaps you sit too much, you stand for too long, all these could actually contribute to you perhaps developing that problems. Once you start noticing that something might be wrong, please rush to your nearest hospital and go and visit a specialist doctor. Preferably, if you're having a backache problem or if you're having, a spine problem, preferably go and visit a neurosurgeon. They will be able to help. Doc, let's talk about now prevention.
Yeah.
Many Zambians, due to the economic challenges, they'll have to wake up in the morning, go to their farms, go to their garages, go to the mines and all that, and do that labor 24/7.
Yes.
Exactly. Bearing that in mind,
Yes.
how do we begin addressing the issue of prevention?
Okay. So, the main issue, if you are doing hard work, it's okay, but you have to do it in the right position.
Okay.
If you are about to carry heavy object, it's not correct to lean forward and carry it like this.
Okay.
No, you have to be first in the squatting position, then you carry it. Okay. And you must not carry very heavy objects. It will be very harmful to your spine, and it will be a big overload to your spine. Gradually, this time, okay, you will carry it, next time you will carry it. After that, you will find difficulty with carrying it, and you will have damage, real damage in your spine. So just don't overload over yourself. You can even push it or use whatever you can use to avoid carrying heavy object, because this is very dangerous to our spine. This is the first issue. The second thing, if you are using an office like this and you have to sit for a very long time, okay, you can sit for a long time, but every 1 hour you need to move. This is not difficult. Every 1 hour, move around, then you can sit again. And when you are sitting, keep in your mind you are sitting in a correct position for your neck and for your spine. Correct position. Okay? If you are driving for a long distance, it's the same. Every 1 hour, you need to stop, move around, then you can sit again. Okay? This is very important. What if you are suffering from very mild back pain? Don't put in your mind that total rest 100%, this is the cure. No. It's okay, it's part you can rest, but there is another part you need to move also. Okay, so resting totally, it's not perfect, and moving very hardly, it's not good also. So you have to mix both, okay, and moving in a correct position. If it's available for you, maybe to run for 10 minutes in the morning, maybe to even walk for 10 minutes in the morning, exercising will improve your blood circulation, will improve your muscles, will improve the whole body. So it will generally help you to be healthy, to be a healthy person. 10 minutes, it will not affect anyone. And I can see a lot of Zambians that they are exercising. I see this in the streets. Yeah, This is very good. I become very happy when I see this. Okay. Yes, this is very good. So it's very small points, but it's very important to our spine and to our health, isn't it? Yes. It's very simple, but it's very serious. Okay. Yes.
How long does it take for somebody who is doing, for example, hard labor-related work?
Yes.
To develop this spine problem? Does it take years, months? Is it just a matter of weeks?
No, according to the type of work he is doing, usually it takes years. It's an accumulating process. Okay. But sometimes some patient presented with me, they were trying to carry very heavy object. At that time, they have fracture in their spine. Suddenly, at the same set, if they were trying to carry very, very heavy object, at that time your spine will be fractured, or you may have tear in the tendons of our spine. This is at the same set. But usually this problem is accumulating over the years. After a while of very hard working years, after a while you will find that you are having difficulty with moving because of the pain.
If we were to quantify this in terms of gender,
Of what?
in terms of gender, male, female,
Yes.
which gender do you think is most likely, according to the problems that you usually encounter?
Yes.
Which sex is usually likely to suffer from back pain, spine problems?
Usually it's equal.
Okay.
But I have seen more females than males here in Zambia. I don't know why. Maybe you are resting too much.
I think women. I think women carry a lot of heavy stuff for a long time.
Yes.
I think so.
Yeah.
Okay.
Yes.
Oh, okay. So mostly it's women.
In Zambia, yeah,
More
I have
in
noticed
Zambia.
that it's more in women.
Oh, okay.
But usually it's equal, male and female equal. Usually.
Oh, okay.
Yes.
Oh, okay. So once you put somebody on treatment,
Yes.
how long does the treatment take?
Usually it takes around 2 weeks for physiotherapy, for the medication, for everything, 2 weeks. And for the instruction, like modifying your workstation, it's for life. It's a lifestyle, as I'm telling you. For exercising, it's a lifestyle. But for medication and physiotherapy, it may take around 2 weeks.
Oh, okay, 2 weeks.
Yes.
Oh, okay. And once that 2 weeks is done and you make your cross-examination and assessment, what are some of the points that you usually look at when you're making your assessment after the 2 weeks?
Most of the patients after the 2 weeks, they totally recover.
Okay.
There is no pain, no neck pain, no back pain, everything is normal again. But they have to just put some points in their minds, like lifestyle. This is again, and I know I'm saying it again and again, but this is most important.
Okay.
Yes.
Oh, okay. So lifestyle definitely is the most important aspect that women, men need to change in Zambia.
Yes.
Oh, okay. If I remember well, in the previous episode, you talked about the putting up of screws.
Yeah.
At what stage do you usually recommend that screws be put up?
When we have a fracture in the spine, like if anyone have an accident and he have a serious fracture in his spine, at that time he will need screws, fixation with screws and rods. Some patient with hard workers, who is hard workers for years, at that time they will suffer, after a while they will suffer from some slippage. It's a blocks over each other. Sometimes there is slippage like this.
Oh, okay.
This slippage will compress over the nerve. When there is compression over the nerve, at that time we will need to do reduction and put screws and rods to fix the vertebrae to prevent slippage again.
Oh, okay.
Yes.
Okay. So once those screws are put,
Yes.
Do patients expect pain time and again as a result of screws? Pain?
Yeah, so for a while after this type of surgery, the patient will suffer maybe for 1 month from back pain, and it's not severe. Usually it's moderate or mild back pain. After a while, this will totally disappear, and he is okay again with no pain in the legs or the arms. Yes.
Okay. All right, so we're still discussing spine problems and backaches. We take another short break. We'll be right back.